As with many things over the last 5+ months, we've had to get creative in how we handle typical in-person events. This year's NIH Directors Award Ceremony is no different. Because NIH staff cannot gather together to celebrate this year's award recipients in the Masseur Natural Auditorium, Ellen Rolfes and I will be virtually recognizing and congratulating those NHGRI employees who have received awards. Each year, institutes and centers submit award nominations for consideration by the NIH Director, Francis Collins. This year, NHGRI is honored to have received 3 awards, one that NHGRI submitted and 2 that were submitted by other institutes and centers that included NHGRI staff among the award recipients. So let's get started with the announcement of our award recipients for the 2020 NIH Directors Award Ceremony. In the scientific medical category, the GM1 therapy group is receiving an award for writing an IRB-approved gene therapy protocol for GM1 gangliosidosis, obtaining an IND, and beginning treatment for an affected child. This team, led by Dr. Cindy Tiff, has accomplished a feat that seemed impossible for a small group. Dr. Tiff began over 12 years ago to assemble a cadre of dedicated physicians and intramural and extramural investigators who laid the groundwork for a gene therapy trial for the fatal disorder, GM1 gangliosidosis. This required the development of a viral vector to deliver the gene, demonstration of a feline model that gene therapy rescues the phenotype, collecting natural history on the largest cohort of GM1 patients, identification of outcome measures suitable to the FDA, and obtaining funds to produce sufficient GMP-grade vector to deliver to a cohort of patients. These extraordinary efforts culminated in the first-in-human delivery of a normal gene, encoding the enzyme that is defective in these patients, given to a 10-year-old girl with this devastating disorder.
Now, it took a lot of people to accomplish this, and I will briefly summarize each person's contribution to this outstanding effort. Dr. Tiff led the effort and secured both private and corporate support for this project. Jean Johnston drafted phase 1 and 2 and expanded access protocols and navigated both the new, at least NHGRI, iris tracking system, the new NIH Common IRB, and the FDA to secure approval. Dr. Priscilla D'Souza and the new pediatric ambulatory care team provided clinical care during the patient's 2-month stay at the clinical center. Dr. Maria Acosta, child neurologist and an integral member of the GM1 team, closely tracked the progress of study participants. Reina Huang is a postbac IRTA, and she was responsible for receiving and processing all research specimens for analysis and interfacing with the patient and their family while they were at the NIH to make sure all necessary study activities were completed. Claire Driscoll and Anna Salove helped establish the necessary CRADA and regulatory requirements for the study. Dr. Zena Quesado was fundamental in overseeing clinical support and patient care for higher risk study participants. Karen Grinnan managed aspects related to the study vector, including oversight of pharmacy protocols. Dr. David Lang helped oversee patient care planning and managed patients during pediatric admission. Dr. Audrey Thurm was fundamental in the design of outcome measurements, inclusion and exclusion criteria, and neuropsychological assessments of participants. Dr. Eva Baker oversaw and developed protocols by neuroimaging assessments for participants. Dr. Scott Paul conducted assessments and evaluations of participants as part of the required study protocol. Dr. Sarah Hall worked with the new IRB and all the regulatory ethical aspects of the protocol. Dr. Mohammed Youssef oversaw the anesthesia and related procedures. Krista Cato helped coordinate and provide pediatric care for research participants during inpatient and outpatient visits.
The initiation of this study was a red letter day for NHGRI and the NIH Clinical Center, and signals another triumph for gene therapy at the Institute. Congratulations to this team for this astounding accomplishment.
Now we have another category, the administrative category. Andreas Baksavanas is receiving an individual award for his extraordinary leadership and scientific vision and overseeing efforts to align almost 40 researchers in the Center for Information Technology, or CIT, into intramural research programs across the NIH. Dr. Baksavanas made outstanding contributions towards meeting the NIH mission and optimizing organizational resources through his exemplary leadership of the realignment of the CIT Office of Intramural Research staff and programs during 2019. Having realigned a total of 38 individuals to 8 new ICs, plus the reimagined intramural function within CIT in just a short 9-month period, it illustrates the dedication, management, and leadership Dr. Boxavanis brought to this complex task. Dr. Boxavanis also displayed great care and concern for the individuals affected by this change and made significant efforts to assist these employees with managing the change. Way to go, Andy.
Finally, and also in the administrative category, Ellen Rolfes is receiving an award as part of the Optimize NIH Property Team in recognition of extraordinary initiative and leadership in carrying out activities to improve the NIH property program operations and benefit the NIH environment. Under the leadership of Dr. J.J. McGowan, Ellen Rolfes, Brian Trent, George Martinez, and Emily Berlou, the Optimize NIH Property Committee established and approved its charter to facilitate the efforts of the 3 teams and to provide recommendations to the NIH business owners for consideration. Some of the significant fiscal year 2019 accomplishments include creating a culture of personal property awareness and individual user accountability through the NIH-wide implementation of the NIH Property Management Portal, reshaping policy to conform with technological advances, and creating standard and model for future property service centers. Kudos to Ellen for her role in this effort. So in closing, each year it gives me great pride to see NHGRI staff members recognized by the NIH director at the NIH Directors Awards ceremony. Thanks to all of the award recipients for your remarkable contributions to NHGRI and NIH. And also, thanks to the entire NHGRI staff for their resilience and perseverance during these highly unusual times. We will get through this, and we will celebrate the next time we can actually gather together in Massor or Natcher Auditorium. Once again, please join me in virtually congratulating this year's awardees, and thanks to all of you for what you do at NHGRI.